Hello, my name is Stephen Chan, and I'm the Vice President of the American Society for Clinical Investigation. Today, we have the honor of talking with Dr. Frederick Korley, who is the 2026 Lewis W. Sullivan MD Award winner. This award recognizes significant scholarly achievement of a mid-career scientist. Dr. Korley is a professor with tenure at the University of Michigan, and he is the Associate Chair for Research in Emergency Medicine. So congratulations, Dr. Korley.
Thank you so much, Stephen.
Can we start off by having you tell us a little bit about yourself, your training program and path, as well as how you came to study the problems that you're interested in lab?
Yeah. So thanks for the question. So I'm an emergency physician, and what I'm passionate about is taking care of people and finding new ways of taking better care of people. And my journey to a research career has been non-traditional. After residency training, I took a job at Hopkins as the director of simulation education, and I knew nothing about research. And I did that for 3 years, did a good job, won Teacher of the Year award and enjoyed teaching. But then I realized that in emergency medicine, because we're such a young specialty, the biggest need was the evidence base that backs what we do. And I decided that what I really wanted to do was contribute to that evidence base and not just do things because my attendants say so, but do it because I know the data says so. And so I decided to go back to school to get a PhD. And so I had a KL2 award from the Hopkins CTSA and went to the Bloomberg School of Public Health to do a PhD degree. And at that time, the thing that was really bothering me in emergency care was how long it took for us to answer that question. Doc, I have chest pain. Am I having a heart attack? It used to take almost 24 hours back then. And so my PhD thesis focused on high sensitivity troponin. Actually, it was one of the first studies of high sensitivity troponin in the country, where we're looking at, could high sensitivity troponins help us improve how quickly we answer that question, am I having a heart attack? So while doing that, I was working in the lab of a proteomics guru, Jenny Van Eyck, who is currently at Cedars-Sinai, who was an amazing mentor. And during one of the lab meetings, I realized that they had discovered some new proteins, novel proteins that were markers of brain injury in sickle cell patients with silent brain ischemia. And so I got thinking that, if these markers are probably just markers of neurodegeneration and it could happen, they could be released from any cause. And in emergency medicine, there are just no way to accurately diagnose acute brain injuries. Just one of those organs where we have no blood tests. Every organ has blood tests, no blood tests for brain injury. And so we started thinking, could these proteins, be useful in traumatic brain injury? And so that was a pivot ultimately, and led to a career trying to figure out ways to diagnose traumatic brain injury better and to develop new therapies for traumatic brain injury. And that's what I've been focused on for the last several years.
Wonderful. What factors do you think were most critical to your success thus far?
So several factors. One was the training. And I kid you not when I say that, when I walked into my first PhD class, I knew nothing about research. So there was just no way I could do it. And, taking that time out to get the tools to be trained, I think was critically valuable for me. Mentorship was the other critical thing. I have been incredibly fortunate to have worked with, some of the most amazing, brilliant, generous people, who have taught someone who knew nothing, because the classes teach you some stuff, but ultimately, a lot of what we learn is based on hands-on practice, and I've had the fortune of learning that from from some really amazing people. I've also been in environments that nurture training and provide opportunities to do good work and provide opportunities to collaborate with amazing people. And I think that has also contributed. The last thing I'll mention is that I am naturally just creative. And so I am always just thinking about how can we do it better? How can we, yes, I know this is how we do it today, but how could tomorrow look way better than today? So those are some of the things I would say have helped me so far.
That's really inspiring. What kind of obstacles can you remember that were also in your path towards this success?
So in terms of obstacles, I mean, frankly, one of the biggest obstacles has been me. Um, I I don't know that I've faced a ton of external obstacles. And yeah, there's been times when, some additional funding could have been better. Um, but I think that yeah, some of the limitations are time. There's so many things I want to do, but so little time. And then the second one is also kind of related, which is the fact that by being an emergency physician with varied interests when it comes to medicine and diseases, I tend to um, gravitate towards the problems that matter the most, and a lot of times it's not just one, and a lot of times it's not just one direction, and so I think that. And what has been an obstacle or an advantage, yet to fully decide. But I think that that has also led me to do a lot of different things and not necessarily honing on like one single thing, which I think a lot of scientists do. But I've enjoyed it all the same.
So what are your future directions in your research and your career?
So we're very proud of some things we've done now, which include helping with the discovery and validation of some blood-based biomarkers, contributing to the work that led to FDA approval of the first blood tests that that are being used clinically now. Um, Working with engineers to create point of care device so we can measure these biomarkers and do it on a cheap because a lot of these discoveries can go to the people who really need them in low resource areas if we don't make them cheap. Done work in implementing these biomarkers clinically, and at the University of Michigan for the last year or so we've been using these tests to treat patients clinically, so seeing that full cycle has been awesome. And what's next is really doubling down on finding therapies for TBI patients, and been fortunate to be able to lead some clinical trials where we've collected a ton of samples and very well phenotyped these patients, and now we're at a point where we want to do very deep proteome profiling, so we can identify druggable targets and ultimately be able to take them into clinical trials so we can make people better.
Wow, what an exciting future. So I have one final question, which is, do you have any lessons learned about your training path and any sort of advice that you would have for trainees who are listening?
So in terms of lessons learned, number one, I would say is never be afraid of making a mistake. I At the beginning of my career, because I, grew up in or had, low income household um, and was determined to be successful. I thought, failure was always going to be a big distraction. And so I was really intimidated in the beginning, by failure. But then when I got to the point where I understood that failure is important because you at least have learned that that is not the right path to follow, um, that became very freeing, and it allowed me to imagine more, to take take bold risks. And I think that has been like very beneficial. So yes, I would say, one major thing is not to be paralyzed by fear. Um, I would also say it's important to stay humble, and understand the limitations in your knowledge. I think it's something that I have done very well, and I just understood, my limits, and built great teams around me. Because I think the best science is done in a multidisciplinary way. Um, and the last thing I'll mention is it's good to dream. And as a scientist, this is one of the fields where being a dreamer is really important, because the most successful are the most powerful dreamers. Because if you dream it enough, and if you work hard enough, your dreams can come to life.
Dr. Korley, thank you very much for spending time with us, and congratulations on the significant Milestone Award.
Thank you so much. I appreciate it.